Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot. It's going to be a very short, quick Kahoot. We're going to be going over metabolic disorders. Now, before we get started, as always, I'm going to ask you to please support me and support this channel. How can you do that? I'm so happy you asked. Like this video, go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. My book, NCLEX NGN RN cheat sheets is out. It is available. You can get your copy on my website, nexusnursinginstitute.com. Test bank coming soon. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere. Nexus Nursing. Be sure to check that out. Now, without any further ado, guys, let's get started. Metabolic disorders. First question. All right, a nurse is caring for a patient with SIADH. Which of the following findings is most characteristic of SIADH? Would it be increased urine output and decreased serum sodium? Would it be decreased urine output and increased serum sodium? Would it be decreased urine output and decreased serum sodium? Or would it be increased urine output and increased serum sodium? What do you guys think? Okay. Wow, only 33 of you guys chose the correct answer. So let's talk about this. SIADH is syndrome of inappropriate antidiuretic hormone. What is happening? Patient has way too much ADH, way too much antidiuretic hormone that's being secreted. What is antidiuretic hormone? Anti against, diuretic, urinating all over the place hormone. So it's a hormone that keeps you from urinating all over the place. It makes you hold on to your urine, right? So if a patient has SIADH, they're holding on to all of their urine. They're holding on to all of their fluids. So urine output is down because they're holding on to all their fluids, right? Here's what's so crazy. The urine output is down, but the little bit of solutes that that patient has is all going out in the urine. So urine output is down because they're holding on to all their urine, but all the solutes that the patient has is going out in the urine, in the little bit of urine that's coming out. So, and this is very important. This is how it gets tricky. This is why I'm taking my time to explain this to you guys so you guys don't get tricked when you get these kinds of questions. Okay? If the patient has SIADH, and that means they're holding on to all their urine, which means urine output is down. Urine specific gravity is what? Up. Why is urine specific gravity up? Well, I just told you. Even though they're not urinating, that's why urine output is down. The little bit of solutes that they had in the blood, it comes out in the little bit of urine that they urinate. So that's why urine output is down, but the specific gravity, the weight of that little bit of urine that they let go of is up because all those solutes are coming out. All right. Well, what about the blood osmolarity? What do you think is going to be the blood osmolarity? Is it going to be up or is it going to be down? It's going to be down. All of the solutes, the sodium, chloride, all those solutes that were hanging out in the blood, it goes out in the little bit of urine that the patient urinates. So urine output down, urine specific gravity up, but serum osmolarity, that's that concentration of the blood down because all those solutes that were in the blood goes out in the little bit of urine that comes out. I'm telling you, if you guys don't understand what's happening, you're going to get these test questions wrong because it can be very confusing. So I want you to really think through this, okay? All right, let's move on. Okay, a nurse is caring for a patient with diabetes insipidus. Which of the following findings is most characteristic of diabetes insipidus? Here are the options. Increase urine output and increase serum sodium, decrease urine output and elevated blood glucose, increase urine output and decrease serum sodium, or decrease urine output and increased serum sodium. Oh, I can't speak. Thank you, Shelda. The code to get in is 736-602. 736-602. I love that. Very good. So after I explained SIADH, most of you guys got it and you guys understood diabetes insipidus, which is the opposite. In diabetes insipidus, the patient doesn't have enough antidiuretic hormones. So they're urinating all over the place. They're like Oprah. You get urine, you get urine, you get urine. Everybody gets urine, right? This patient's urinating so much to the point of dehydration. So when it comes to diabetes insipidus, the arrows go the opposite way. Urine output is what? Up. They're urinating all over the place. But even though they're releasing all of this urine, the urine specific gravity is what? Down. Why? The solutes are staying in the blood. Speaking of blood, if the urine output is up and the urine specific gravity is down, what do you think the serum osmolarity would be? What do you guys think on the live? The serum osmolarity, would it be up or down in diabetes insipidus? Up. Very good. Increased. Very good. Okay, let's keep going. Y'all better know this. All right. A patient presents with moon face, buffalo hump, central obesity. The nurse knows that these are characteristics of which disorder? Would it be Addison's disease? Would it be Cushing's disease? Would it be hypothyroidism? Would it be hyperthyroidism? This was an easy one. Everyone should get this. Very good. Cushing's. So, this is where the patient has been exposed to prolonged excessive levels of cortisol, right? So we see the patient's going to have that moon face, that buffalo hump, the central obesity, other characteristic symptoms, the purple striae, easy bruising, thin skin, gynecomastia. If he's a male, he'll have the male boobs. Um, what's that word I'm looking for? Hirsutism, where if she's female, she'll have like the beard or the mustache, she'll have the facial hair. Um, the men tend to be they'll have, well, men and women, they'll have decreased libido. They tend to have depression. Wouldn't you be depressed if you had all these symptoms, right? So make sure you know the classic signs and symptoms of Cushing's disease. Now let's talk about the other disorders before I move on. Very quickly, Addison's disease. You see it starts with ADD. Why? Because you need to add salt, sex, and sugar. That's the problem with Addison's disease. You need to add salt, sex, and sugar. Patient does not have enough of those three things. They need to add salt. Those are your mineral corticosteroids. You need to add sex. Those are your androgen hormones. You need to add sugar. Those are your glucocorticoids. Patients don't have enough of those. Okay. Hypothyroidism, you know your thyroid glands right here. Whenever you think of that Whenever you think of the thyroid gland, I want you to think of metabolism. So if the patient has hypothyroidism, metabolism is really slow. That patient's going to be gaining weight. Where if the patient has hyperthyroidism, the metabolism is very fast. They're going to be losing weight. Code to get in 736-602. Okay, a patient with hyperthyroidism is being discharged. Which of the following signs symptoms should the nurse instruct the patient to report? Weight gain and constipation, excessive sweating and heat intolerance, increased appetite and bradycardia, fatigue and dry skin. Which would you go with? The three S's for Addison's is salt, sex, and sugar. Salt, mineral corticosteroids, sex, androgen hormones, sugar, glucocorticoids. Salt, sex, and sugar. You need to add it in Addison's disease. Very good. What is the one word in this phrase that should have made you know it was the answer? Excessive. Anything that is excessive, or if it says severe, that needs to be a red flag to you. So this patient has hyperthyroidism. Thyroid gland is in overdrive, right? Now the patient's experiencing excessive sweating and heat intolerance. We're concerned about thyroid storm. Very good. A nurse is caring for a patient with hypothyroidism. Which of the following would the nurse expect to assess in that patient? Would it be weight loss and anxiety, diarrhea and tremors, tachycardia and weight gain, or bradycardia and cold intolerance? Thank you, Bia. Very good. Bradycardia and cold intolerance. Why? Their thyroid gland is not functioning the way it's supposed to. It's functioning below the level that's supposed to, right? Metabolism slowed down. Everything slowed down. Heart rate slowed down. Blood pressure slowed down. Cognition slowed down. Peristalsis slowed down. I could go on forever. Everything is down. Right? And I want you to pay attention. There's a difference when a question asks you, what would you expect to assess versus what would be of a concern. If you expect to assess something in a patient because that is part of the disease process, that's not going to be a priority versus a complication of a disease process. That's going to be a priority. So make sure you guys know the difference and you're being very careful when you're reading, okay? True or false? People with type 2 diabetes always require insulin therapy for blood sugar control. Is this true or is this false? What do you guys think? People with type 2 diabetes always require insulin therapy for blood sugar control. False. Very good. All right, you guys on the live, tell me what's the one word you saw in this sentence that made you know it was false. Quickly. Always. That's right. The minute you see always, never, only you see any of those all-inclusive words, stay away from it. Usually that's not the answer. And here's the thing. Type 1 diabetics, their pancreas is shot, is dead. They've got nothing going on. So they cannot make any insulin because the pancreas is responsible for making insulin. Remember, the beta cells in the islets of I can't speak. The beta cells in the islets of Langerhans of the pancreas, that's where insulin is produced. But the patients with type 1 diabetes, that pancreas is not working. So they're not making any insulin at all. So guess what? Your type 1 diabetics, they're the ones that absolutely require insulin to live or they're not going to live long. Your patients who have type 2 diabetes, they're either not making enough insulin. So they're making insulin, they're just not making enough to uh, um, deal with the amount of sugar that they have in their body, or they've developed insulin resistance. They make enough insulin, the body's just resistant to it, right? So the patients who have type 2 diabetes, usually the first way that the nurse practitioner or the healthcare provider will try to get that under control is by diet and exercise. And then if that doesn't work, they'll move them on to an oral hypoglycemic agent. And then that doesn't work, finally we'll end up putting the patient on insulin. But the patients who are type 1, automatic insulin, or they're not going to live long at all. Okay? True or false? Diabetic ketoacidosis is a common complication in patients with type 2 diabetes. True or false? DKA, is this a common complication in your type 2 diabetics? False. We see this more in type 1, and the reason for that, the patients who are type 1, remember how I just explained to you type 1 absolutely needs insulin or so what happens is they don't get that insulin and they have to get an exogenous source, EX, not endo, because endo means from within. Exogenous source of insulin because they're not making their own insulin, so they have to get outside source of insulin. And they don't get that where their blood sugar gets extremely high. And so what happens is their body will start breaking down fat for energy because they don't have that insulin. And that's why it's more common in type 1 diabetics. Why? Because as I said to you before, type 2 diabetics, they make insulin. They just don't make enough or their body's resistant to what they make, but they make it. Okay? A patient with hyperparathyroidism is at risk for which of the following complications? Hypocalcemia, hypercalcemia, hypoglycemia, hyperglycemia. What do you guys think? A patient with hyperparathyroidism, what are they at risk for? There are only 10 slides in this Kahoot. We're on slide number 8, so we're almost done, guys. Hang on with me. Okay, very good. Hypercalcemia. So read very carefully so you don't mistake hyperparathyroidism with hyperthyroidism. Okay, so the parathyroids, just like you saw in the picture, they sit on the thyroid gland. And so those four nodules look parathyroid. When you think of the parathyroids, I want you to think of calcium. So if the patient has hyperparathyroidism, they're going to have hypercalcemia. If they have hypoparathyroidism, they're going to have hypocalcemia. Notice I said calcemia. That emia means in the blood. Calcemia, calcium in the blood. Be very careful. I'm not talking about the bones. I'm talking about in the blood. So in this situation, if patient has hyperparathyroidism, they have hypercalcemia. That means they have too much calcium where? In the blood. Well, where's calcium supposed to be? In the bone. So patients at risk for what? Fractures. Hello. All right, moving on. A nurse is assessing a patient with hypoparathyroidism. Which of the following is most consistent with this disorder? Would it be hypercalcemia and deep tendon reflexes, hyperphosphatemia and bradycardia, hypocalcemia and tetany, or hyperglycemia and polyuria? You guys are on a roll on the live. Very good. Bryn, very close. Very close. Okay, very good. Hypocalcemia and tetany. Bryn asks, is tetany stiffness? So what happens is the it's a type of contraction that you see, and I'll explain the different types of tetany that patient. Well, let me back up. Let me back up. Let's talk about this first. So the patient has hypoparathyroidism, so that means they have hypocalcemia. The calcium is low in the blood, and when you see low calcium in the blood, you're expecting to see um, increased muscle contractions, and the type of muscle contraction is the tetany. So you'll see where their hand will be like this. They may have trousseaux, they may have chopstick. You guys have to know those two words that I just mentioned. If you're in the nursing program, I promise you're going to see it on a test somewhere. So if the patient has hypocalcemia, the chopstick, which starts with a C, your cheeks start with a C, so that's how you remember the chopstick. Whenever something touches their face will go like this. The extreme muscle contraction of the face, that's due to hypocalcemia. It's a type of tetany. It's called Chostek. Or trousseaux, where you take that patient's blood pressure and as it squeezes, you'll see their hand go like that, right? Literally have a test on this tomorrow. What a coincidence. Not coincidence, that's God. You better thank him. All right, one more. Let's go. A patient with severe hypothyroidism presents with lethargy, hypothermia, and respiratory failure. What are you, as a nurse, going to suspect? Thyroid storm, DKA, myxedema coma, or Addisonian crisis? You guys that are on the live, can you hear any music? Are you guys hearing any music? Yes? That copa. Oh my gosh. I thought maybe you guys wouldn't be able to hear it. I'm on the second floor. All right. Yes, Mike's edema coma. Let's focus. We'll talk about this after the Kahoot. Yes, so the patient has hypothyroidism, which means their metabolism has slowed down severely. Everything slowed down. Patient's lethargic. Temperature's gone down. Respiration's gone down. But not just normally, severely. That's myxedema coma. When you think of myxedema coma, I want you to think of hypothyroidism times 1,000. Okay. Myxedema coma, that is a deadly complication of hypothyroidism, just like thyroid storm is a deadly complication of hyperthyroidism. All right. That's it. Those of you guys who are watching this from YouTube, please make sure you took notes. If you did not, go back and watch this video, and everything I'm talking about, even the wrong answer choices, when I go over them, the reason I'm going over them is because the wrong answer choice may be a question on your test. It's important to know, make sure you know it, okay? So go back and watch that. You guys on the live, let's see how you did.